It is a crisis and a public health emergency. Opiate overdoses are killing people in staggering numbers across the country and right here in Hamilton County. And the problem is getting worse.
There has been no other drug epidemic where 50 to 70 people overdose on average every week, or 4 to 5 people die every week.
The 9 on Your Side I-Team spoke with police, a doctor, and a recovering addict who all say that rumors about drugs are partly to blame. Investigator Hillary Lake looks into the urban legends for us to separate fact from fiction.
First, the facts. Deaths are devastating. A record number 44,000 people didn't make it after an opiate overdose between June 2016 and June 2017, according to the CDC. Ohio ranks in the top 5 of opiate overdose deaths. And overdose deaths in Hamilton County spiked 35% last year to 545. Now, the rumors.
The problem with the rumors, one, it causes this hysteria, and two, it makes it difficult for us to get past the stigma.
Rumor number 1, fentanyl-laced marijuana. Stephanie Schaffner's heard it. She's a former crystal meth and heroin user.
I've heard mostly that the fentanyl is being put in just about anything these days, whether it's marijuana or cocaine or anything. And so, I mean, I'm a true testament to not knowing what's in something.
Drug treatment expert Dr. Sean Ryan says users definitely need to be aware.
If you buy something in a cellophane wrapper on the side of the street, you basically don't know what's in it.
Newtown Police Chief Tom Synan is a member of the Hamilton County Heroin Coalition Task Force.
You're using 2, 6, 8 milligrams of Narcan.
He busts this myth, telling the I-Team there are no confirmed cases of overdose deaths from marijuana mixed with fentanyl anywhere in the country.
I think a lot of where it comes from is that it is not uncommon for when we have autopsies come back from someone who was overdosed to have multiple drugs in their system. And often marijuana is one of those drugs, along with benzos, along with other prescription pills, opiates, and fentanyl.
Rumor number 2, so-called Narcan parties.
That somehow these drug users are all getting together, they're buying this heroin and fentanyl, going to this big party, and let's all use heroin, and then let's get Narcan and be revived.
Stephanie, who used hard drugs for 8 years, tells the I-Team she's never heard of Narcan parties, but the rumor sounds plausible to her.
It doesn't surprise me because people think it's like a safety net and that they can just fall on that.
The Narcan party rumor is a bust too, sort of. Chief Synan says there's zero evidence to suggest Narcan parties exist in Hamilton County or anywhere in the U.S. Dr. Ryan agrees, but he sometimes tells opiate addicts to use with Narcan around.
We tell them if you're going to use, we wish you wouldn't use, and we would like you to go to treatment. But if you're not going to stop, please make sure Narcan is present and that you use with someone you know.
That leads to rumor number 3. Some addicts get high in public places because they know most first responders carry Narcan. Chief Synan tells the I-Team there is some truth to that.
We actually had it happen here in Newtown. 4 people were in a car, they bought some drugs, they had someone test the drug to find out if they overdosed. They actually, when they overdosed, they pulled into Newtown knowing that we would respond and issue Narcan. And we did, and we brought the person back.
Using opiates is risky, but Dr. Ryan says location can matter, just like it did for this woman who got high under a bridge in Lower Price Hill, feet from a fire station that had Narcan on hand.
I definitely am not going to advise them to use in a closed space in the back of a dark warehouse where nobody's going to find them.
Rumors aside, Dr. Ryan says treatment involving medications like Suboxone, along with behavioral therapy, is most effective to break the cycle of opiate dependency.
Period. The studies are profound. They're large. They're well done. They're very scientifically sound.
That's how Stephanie Schaffner detoxed.
You just feel like utter crap in all parts of your body.
And got clean at Dr. Ryan's Brightview Clinic in Cincinnati.
You just don't feel well at all, really.
Now she's celebrating a year of sobriety, living her truth.
I still have a ways to go in my recovery, but I've learned to love myself more than I ever have in my life before.
I worked on this investigation with my colleague Lisa Bernard-Kuhn. If you go to WCPO.com right now, you'll find more of our reporting on myths about opiate use, including rumors about detox and hitting rock bottom. And you'll also find information in case you or someone you love needs help. Hillary Lake, 9 on your side.